Hi, I'm Dr. Miguel Gelfand, Head of Pediatric Surgery at the Cleveland Clinic Children's Hospital. What is a congenital diaphragmatic hernia? A congenital diaphragmatic hernia basically is a defect of the diaphragm where the baby are born basically with a hole or a defect in the diaphragm. The diaphragm basically what it does is a separation of the abdominal cavity and the thoracic cavity. How does CDH affect fetal development? Having this defect basically during the pregnancy makes that all the bowel and sometimes the stomach, the spleen, and even the liver can go up into the thorax. The lungs of the baby are not well developed, and also they don't have enough lung to breathe properly in some of those cases. Once they are born, they manifest in difficulties to breathe, sometimes in difficulty with the heart and how it works, and obviously having the anatomy completely wrong in terms of the part of the bowel are into the chest that has to be treated surgically at some point. So basically once they're born, there are a lot of difficulties, requiring a lot of different treatment to survive this situation. How is CDH diagnosed? CDH is diagnosed in two ways. Most of the time prenatally with the ultrasound, you can see perfectly that part of the bowel is in the chest of the patient. Most of the patients have a prenatal diagnosis. Some of the time they don't have, and we can diagnose this after birth, and usually they represent having a lot of breathing problems, and with an x-ray you can see very clearly that the bowel is in the chest, and you will get your diagnosis of the CDH. How is CDH treated? CDH is treated depending on the symptoms of the patient. Most of them will need intubation, that meaning putting a tube into the trachea to help him to breathe and getting some supplemental oxygen. Some of the patients will require more aggressive treatment called ECMO, that we need to supply directly the oxygen required by the baby because they don't have enough lung to make this interchange of oxygen. Once the baby is stable for surgery, the aim of the surgery is to basically get a normal anatomy. The main technique today is to do it by minimally invasive surgery. We'll put all the bowel and all the organs that were in the chest again into the abdomen and close that malformation of the diaphragm or the hole in the diaphragm to restore the anatomy with a complete separation of the abdomen and the chest with a diaphragm. Those kind of treatment goes accordingly once the baby is born. What's the prognosis for babies born with CDH? With the surgery and the treatment, in the long term, at least 70 to 90% should be survived. Some of them with some difficulties, breathing or eating for a long time, but for the long term, usually they can have a completely normal life. But also CDH can occur with a malformation that will be affected the heart, the lung, the bowel, or other organs within the pregnancy. So obviously, the outcome of these babies will be directly associated with or without any associated malformation with the CDH. That makes a whole difference with a patient in terms of the long-term outcome.